Statins are among the most commonly prescribed medications for managing high cholesterol, a key factor in reducing the risk of heart attack and stroke. These drugs work by lowering the production of cholesterol in the liver, helping to clear low-density lipoprotein, LDL, often referred to as bad cholesterol, from the bloodstream. For millions of people, statins have been life-changing, providing an effective way to combat the dangers of cardiovascular disease. While the benefits of statins are well documented, it's equally important to be aware of the potential risks and precautions associated with their use. Like any medication, statins can affect individuals differently, and understanding how they work in the body is crucial to ensuring their use safely and effectively. Some users may experience side effects ranging from mild discomfort to more serious health concerns. In addition, certain lifestyle factors, other medications, or underlying health conditions can influence how statins interact with the body. Taking a proactive approach to managing your health involves not only following your doctor's recommendations but also staying informed about the medications you're using. Being aware of the possible warnings and considerations associated with statins can help you make better decisions, recognize symptoms that may require attention, and ensure that you're getting the most out of your treatment, while minimizing risks. This video will outline 7 critical warnings every statin user should know, helping you navigate this essential medication with confidence and care. Whether you've been using statins for years or have just started your prescription, this video is designed to empower you with the knowledge you need to support your health journey effectively. Just a quick reminder, this video is for educational purposes only, so do speak to your doctor if you have any medical concerns. With that said, let's jump in. The first on the list is drug interactions. Statins are widely used to manage cholesterol, but their interaction with other medications is an important consideration for users. These interactions can alter how statins are metabolized, potentially increasing the risk of side effects or reducing the medication's effectiveness. It is essential to be aware of these risks and to communicate openly with your healthcare provider to avoid complications. Some medications can interfere with the way statins are broken down in the liver. For example, certain antifungal drugs, antibiotics, and antivirals may inhibit liver enzymes responsible for metabolizing statins. This can lead to an accumulation of statins in the bloodstream, increasing the likelihood of muscle-related side effects, such as pain or weakness, and in rare cases, a serious condition known as rhabdomyolysis. Additionally, drugs used to treat high blood pressure, irregular heart rhythms, or certain immune conditions can interact with statins in ways that may affect their function or lead to adverse effects. Over-the-counter medications, supplements, and herbal remedies can also play a role in drug interactions. For instance, some forms of niacin, often used to improve cholesterol levels, can heighten the risk of muscle-related issues when combined with statins. Similarly, St. John's wort, a common herbal supplement, can reduce the effectiveness of some statins by increasing their breakdown in the body. To minimize the risks, it's crucial to share a complete list of all medications, supplements, and vitamins you take with your doctor or pharmacist. They can assess potential interactions and adjust your treatment plan as needed. Regular blood tests may also be recommended to monitor your body's response and ensure the safe use of statins. By staying informed and maintaining open communication with your doctor, you can use statins effectively while reducing the risk of complications caused by drug interactions. Number 2. Muscle pain and weakness. Muscle pain and weakness are among the most commonly reported side effects of statins and can range from mild discomfort to more severe complications. Statins work by inhibiting an enzyme in the liver responsible for producing cholesterol, but this process may also affect muscle cells, potentially leading to inflammation or damage. The exact mechanism is not fully understood, but the interaction between statins and muscle cells appears to be influenced by factors such as genetics, medication dosage, and the use of other drugs. Symptoms to watch for include muscle aches, tenderness, stiffness, or weakness, which may occur in specific areas or throughout the body. These issues can arise soon after starting statins or may develop after prolonged use. While mild symptoms might resolve on their own, severe or persistent pain, particularly if accompanied by dark urine or significant fatigue, could indicate a more serious condition called rhabdomyolysis. This rare complication involves the breakdown of muscle tissue, which can lead to kidney damage if left untreated. If you experience muscle-related symptoms, it's important to contact your healthcare provider promptly. They may recommend a blood test to measure creatine kinase (CK) levels, which can indicate muscle damage. Based on your symptoms and test results, your doctor may adjust your dosage, switch you to a different statin, or suggest alternative cholesterol-lowering treatments. Taking steps to reduce the risk of muscle issues can also be helpful. For instance, inform your doctor about any other medications or supplements you're taking, as certain combinations can increase the likelihood of side effects. Additionally, staying hydrated and maintaining a balanced diet may support overall muscle health. By staying proactive and working closely with your doctor or pharmacist, you can manage your cholesterol effectively while addressing potential muscle-related concerns. Number 3. Blood sugar concerns and diabetes risk. Statins are effective in managing cholesterol, but they can have an impact on blood sugar levels, potentially increasing the risk of developing type 2 diabetes in some individuals. This effect is believed to be linked to how statins influence insulin sensitivity and glucose metabolism in the body. Although the risk is relatively small for most people, it's important to understand who may be more susceptible and how to address this potential side effect. Certain groups are at a higher risk of experiencing changes in blood sugar levels while using statins. These include individuals who are already pre-diabetic, those with obesity, a family history of diabetes, or metabolic syndrome. Older adults and people who take higher doses of statins may also face an increased likelihood of elevated blood sugar levels. For those at risk, proactive steps can help manage this side effect. Regular monitoring of blood sugar levels, particularly if you have pre-existing risk factors for diabetes, is essential. Your doctor may recommend periodic blood tests to detect any changes early on. Maintaining a healthy lifestyle is equally important. Focusing on a balanced diet that limits refined sugars, engaging in regular physical activity, and maintaining a healthy weight can all support better glucose control. If you're concerned about this potential risk, it's crucial to discuss your medical history and any family predispositions to diabetes with your doctor before starting statins. They may consider prescribing a lower dose or exploring alternative cholesterol-lowering options, especially for those at higher risk. However, it's important not to discontinue or adjust your medication without consulting your doctor or pharmacist, as the cardiovascular benefits of statins often outweigh the potential risks. Through careful monitoring and healthy habits, the likelihood of developing diabetes can be minimized while continuing to manage cholesterol effectively. Number 4. Risk of liver damage. Statins are primarily designed to lower cholesterol, but they can sometimes affect liver function. These medications work by reducing cholesterol production in the liver, which is essential for managing cholesterol levels. However, in some cases, this process may lead to an increase in liver enzymes, signaling potential liver irritation or damage. While such effects are uncommon, it's important for statin users to understand the risks and monitor their liver health. Mild elevations in liver enzymes are typically harmless and may not produce noticeable symptoms. However, more significant liver issues can occur, though they are rare. Symptoms to watch for include fatigue, weakness, loss of appetite, upper abdominal pain, dark urine, or yellowing of the skin and eyes, a condition known as jaundice. These signs could indicate liver inflammation or other issues that require medical attention. Regular liver function tests are a crucial part of monitoring your health while on statins. Before starting statins, your doctor will likely perform baseline liver enzyme tests to ensure your liver is functioning properly. Once treatment begins, periodic testing may be recommended to detect any changes in enzyme levels. This proactive approach allows doctors to identify potential problems early and adjust your medication if needed. Certain factors can increase the risk of liver-related issues with statins, including excessive alcohol consumption, pre-existing liver conditions, or combining statins with other medications that affect liver health. To minimize risks, it's essential to inform your doctor about your medical history and any other substances you use. Avoid making changes to your statin dosage or stopping treatment without consulting your doctor or pharmacist, as this could impact your cholesterol management. Number 5. Allergic reactions. Allergic reactions to statins are uncommon but can occur in some individuals, and it is important to recognize the signs and take appropriate action if a reaction develops. Allergic responses may vary in severity, from mild skin irritations to more serious conditions requiring immediate medical attention. Understanding these potential symptoms can help ensure prompt and effective treatment. Mild allergic reactions to statins may include itching, rash, or hives. These symptoms often appear on the skin and can cause discomfort. In some cases, swelling may occur, especially around the face, lips, tongue, or throat, which can interfere with breathing or swallowing. Severe allergic reactions, such as anaphylaxis, are rare but life-threatening and require urgent medical care. Symptoms of anaphylaxis may include difficulty breathing, chest tightness, dizziness, rapid heartbeat, or loss of consciousness. If you suspect an allergic reaction while taking statins, it is essential to stop the medication and contact your doctor immediately. For mild symptoms, your doctor may suggest antihistamines or other remedies to alleviate discomfort. In cases of severe reactions, such as swelling of the throat or difficulty breathing, seek emergency medical attention without delay. An epinephrine injection may be necessary to manage anaphylaxis, followed by further evaluation at a medical facility. To minimize the risk of an allergic reaction, inform your doctor about any known allergies or past reactions to medications before starting statins. This information will help them determine whether statins are appropriate for you and, if so, which type may be safest. Number 6. Adhering to the correct statin dosage. When using statins, following the prescribed dosage is essential for ensuring their effectiveness and minimizing potential risks. Your doctor determines your dosage based on factors like your cholesterol levels, overall health, age, and potential interactions with other medications. Adhering to this prescribed amount is key to achieving optimal results while avoiding complications. Taking more than the recommended dose can increase the risk of side effects, including muscle pain, liver damage, or elevated blood sugar levels. Conversely, taking less than prescribed or skipping doses may reduce the medication's ability to lower cholesterol, leaving you vulnerable to cardiovascular risks. It's important to understand that statins work best when taken consistently over time, as this allows them to maintain a steady impact on cholesterol production and clearance. To stay on track with your dosage, try incorporating daily habits that make remembering to take your medication easier. Setting an alarm, using a pill organizer, or taking your statin at the same time each day, such as with dinner, as some statins are more effective when taken in the evening, can be helpful strategies. If you miss a dose, follow your doctor's instructions on how to proceed, and avoid doubling up on the next dose, as this may increase the chance of side effects. It's also crucial to communicate with your doctor if you experience side effects or changes in your health. They may need to adjust your dosage or switch you to a different statin to better suit your needs. Never alter your dosage or stop taking the medication without consulting your doctor, as this could disrupt your treatment and negatively affect your health. Lastly, Grapefruit Interaction. Statins are a commonly prescribed medication for lowering cholesterol, but one important consideration for users is their interaction with grapefruit and grapefruit juice. Consuming grapefruit products while taking statins can interfere with the way the body processes these medications, potentially leading to harmful effects. Understanding why this interaction occurs and how to manage it is essential for ensuring the safe and effective use of statins. The issue arises because grapefruit contains compounds called furanocoumarins, which can inhibit an enzyme in the liver and intestines known as cytochrome P453A4, CYP3A4. This enzyme plays a key role in metabolizing certain statins. When grapefruit inhibits CYP3A4, it reduces the breakdown of the medication, causing higher levels of statins to accumulate in the bloodstream. This increased concentration can raise the likelihood of side effects, particularly muscle pain or weakness, and in rare cases, a serious condition called rhabdomyolysis, which can lead to kidney damage. To avoid these risks, it is best to steer clear of grapefruit and grapefruit juice while taking statins, especially those known to interact strongly with the fruit, such as atorvastatin, simvastatin, and levastatin. Not all statins are affected to the same degree, and alternatives like pravastatin or rosuvastatin may be less impacted by grapefruit consumption. If you are unsure about whether grapefruit poses a risk with your specific medication, consult your doctor or pharmacist for clarification. Reading food and beverage labels can help you avoid unintended grapefruit exposure. Additionally, Discussing your diet and medication use with your healthcare provider is crucial for managing this interaction. By staying informed and taking proactive measures, you can minimize risks and maintain the effectiveness of your statin treatment. In conclusion, if you're taking statins, these warnings aren't meant to scare you, but to empower you. Understanding the potential risks and how to manage them can help you get the best out of your medication while protecting your health. Always talk to your doctor before making any changes. And remember, managing cholesterol effectively isn't just about medication, it's about informed choices. Stay proactive, stay informed, and take control of your heart health. If you found this helpful, give it a like, share it with someone on statins, and don't forget to subscribe for more clear, practical health insights.